Welcome back. So in the previous video, is tattoo therapy a thing? We asked that question and we pointed to the fact that there probably is some therapeutic benefit. We highlighted that maybe some people are just gesturing about tattoo therapy, but then also that there's more deliberate courses of action that you could probably take that provide real therapeutic benefit in your tattoo process. Now we're going to go a little bit further and we're going to analyze the different layers involved and why something like tattoo therapy is starting to pop up all of a sudden. Okay, so let's unpack therapy and tattooing individually, because if we want to qualify tattooing as something that's therapeutic, we need to understand what we're talking about. So there's different types of therapy. There's like a mental and psychological type of therapy, and then there's like a material or a physical type of therapy, psychotherapy and physical therapy. If you think of seeing a psychologist, that's someone you go to talk about what's going on for you internally, opposed to a physiotherapist. It's someone you're going to go and see because there's something wrong with your leg or your knee or your ankle. And sometimes there's these moments where there's an interesting crossover of the talk therapy combined with something physical that results in somebody becoming an unintentional therapist. You know, people experience it and talk about it all the time, right? Like a barista who's making a coffee for someone and he hears somebody's life story, or the hairdresser. You're sitting there and you're there for a set amount of time and you end up talking about what's going on for you. Or the taxi driver, into the car from the airport trying to get somewhere. You're in a different place. You don't know the person. You open up to them. You tell them a whole bunch of things. And they might even give you a bit of valuable reflection or feedback, right? But the thing is, the barista then doesn't claim to be a therapeutic barista, nor does the hairdresser claim to be a therapeutic hairdresser, nor does the taxi driver start to curate a therapeutic taxi service. So what we're looking at here is that there's a physical thing that isn't therapeutic and a psychological thing that's providing some remedy to somebody. When you go to get a coffee, you just want to get a coffee. When you go to get a haircut, you want to get a haircut. You get in the taxi, you have somewhere that you want to go. And so I think a lot of the time when people are receiving the therapeutic benefit of a tattoo, it's falling into this same category. A lot of people are going to get a tattoo because they want a tattoo and it ends up providing some benefit. And this is how we've ended up with these contemporary claims of tattoo therapy. But what's the difference between the therapy you receive in these unintentional environments and what you would receive from an actual qualified therapist, a psychotherapist? We look at something like cognitive behavioral therapy or internal family systems or other psychotherapeutic systems. The difference between them all, the thing you got to look at is like whether it's actually resolving any issue. Are you keeping track of it? How do you even remain accountable to what it is that you're working on? How do you do that? And a qualified therapist has systems in place to allow them to understand what's going on for the person, to identify what it is that they're actually working on, and how to move their clients through a process that's tried and tested and gives them resolve. Also allows them to mitigate this huge periphery of potential problems that you can run into when you start going into a therapeutic process with somebody. So I think the distinction between actual therapy and a more superficial layer of therapeutic benefit or value that someone gets because they are feeling heard or recognized in a way that they don't usually in their everyday environment is an important distinction to put in place if we start claiming to be tattoo therapists or if we're someone that's looking for a therapeutic experience. If we look at a physical therapy that represents this, it'd be like remedial massage or a relaxation massage, right? The relaxation massage feels good and it might solve some issue of stress or pressure or give you some reprieve and relief in a moment, right? So it is physical and it does aid and relieve an issue on a surface level, but it doesn't get to the root like a remedial massage would. A remedial massage, we're like looking at what caused the problem in the first place. You know, maybe you got a sore neck and the trained practitioner can like trace that down to your ankle and he does some work on your ankle and then that resolves the issue in your neck. And it might be really, really uncomfortable when they're pressing on that point on your ankle. So we look at this physical layer, we look at this psychological layer, we look at these actions, we look at the talking, the external and the internal. And obviously, all of those things coexist within a tattoo experience. So again, it's easy to see how someone can land in this place where they go like, "Yeah, tattoo therapy, therapeutic tattoo, totally. That's what I'm doing. That's what I'm after." But let's look at like what a tattoo actually is. Okay, so we have the skin, necessary. We have the ink, necessary. We have the incision. So by definition, that's all a tattoo is. It's ink in the skin through an incision, and you get a permanent marking, right? But is that all tattooing is? Like we've just said, there's this whole experience that unravels between you and the person doing the tattoo for you that also needs to be considered. And we can also consider things that overlay the skin that are a physical therapeutic process, such as acupuncture and acupressure and massage and bloodletting and cupping and moxibustion and fascia massage, chakra systems, meridian systems. There's all sorts of layers within the physical domain of the tattoo that could also be considered. And, old cultures and some of the examples of old tattoos that we have, like Otzi with, 80% of his tattoos being on acupuncture points, and cultures that understood that the tattoo played a massive psychological role in the process of the person's development. They were fully aware of all of these layers that it seems our contemporary tattoo culture is catching back up with and trying to repackage in a way, even though it's always been there. In fact, it could be the original purpose of marking the skin. Maybe art and adornment's a byproduct. And so how we've landed here with a desire and a participation for tattooing to provide some therapeutic benefit is really obvious. We can track it. I tracked it myself through my process. So go back 16 years. I was interested in tattooing as art. I got involved in that way, did an apprenticeship, learned how to tattoo people, worked really hard, developed myself and my skills in the craft so that I was doing better tattoos aesthetically. At the same time, globally, society was starting to participate more actively in the process of getting tattooed. So there was more exposure happening. It was happening through screens and TV shows. And the generation prior to that, which was holding a particular stereotype and stigma around tattooing, started to get imprinted with a different thing, like their children were getting tattooed and these generations were having to ask them why. And so there was this feedback happening collectively where humanity needs to make more sense of what it is that they're doing, getting tattooed so heavily. So as the popularity of tattoo increases, it also demands more introspection into the process, whether it's from the individual or whether it's from other people having some inquiry into what other people around them are doing. And so we developed this place of going, why do we get tattooed? We go from tattooing just for art or tattooing on the fringe as something that's pushing the limits and alternative to the mainstream, to it becoming more mainstream, more acceptable, and bringing the question to the surface of what it is that we're doing. And so very quickly, it goes from just an artistic or a fringe process to an intentional process that lots of people are participating in. They're allocating a reason for what it is that they're doing, the why. And that was my path too. So I went from like really interested in the artwork to like, hang on, why am I doing this? Going through that sort of second wave of awareness in my own development, going, I want to be tattooing people really intentionally. I want to be conscious of what I'm doing, becoming interested in their stories and why they're there. This is the start of that psychological layer developing over the top of the physical. And that leads us to this place of going, well, we know why we're doing it now. We're asking that question, but we're going to pay even more attention to what's happening to someone when they get tattooed. And this is really the first time the therapeutic lens comes in and we start to see that there's a correlation between why someone's getting tattooed and the result of what it is that they experience on the other end of this transformational act. That the tattoo itself and the process of marking your skin with a really good idea of why it is that you're doing it can move you from one state of being into another state of being. And there's the potential for that to provide a beneficial recalibration, let's say. There's also the potential for it to destabilize somebody. And we really got to follow the thread a lot further through than the moment of the tattoo to understand if there is a positive therapeutic outcome for somebody. So in the next video, we'll look at what can happen and what you can expect and the different trajectories that are possible when you approach tattooing in a therapeutic way or in an intentional way. I hope that was useful for you. Please subscribe if you want to stay in the loop with our content. And if you have any questions, you can just drop them in the comments below. Next, we're going to look at some of the ways that people are currently engaging with tattooing therapeutically and whether it's actually of any benefit.